Today we are exploring how state agencies for the control of AIDS, SACAs, are shaping the future of HIV prevention in Nigeria. We will be speaking with representatives from Imo State Agency for the Control of AIDS. Across the country, SACAs are strengthening policy alignment, building health system capacity, and working with communities to expand access to PrEP. But while daily oral PrEP is becoming more visible, long-acting injectable PrEP such as Cabla still sits in an evolving policy space. What opportunities exist, what gaps remain, and what will it take to ensure equitable access for young people, women, and key populations? Join us as we discuss the opportunities, challenges, and the path forward with SACA at the center of Nigeria's HIV response. With me today is the acting director of Imo State Agency for the Control of AIDS. He will be introducing himself, and also the program monitoring and evaluation officer. Good morning, Doc. Please, may we know you?
Good morning. Okay, my name is Dr. Ibebuike, JohnPaul.
Okay, and your role, please.
Yes, I'm the acting DG, Imo State Agency for the Control of HIV and AIDS.
Okay, you're welcome.
Imo SACA.
Okay, so can we know you?
Thank you very much. I so much appreciate. My name is Chinedu Ugwuezumba. I'm the Program and the Monitor and Evaluation Officer, Imo State Agency for the Control of HIV/AIDS, Imo SACA. You're welcome.
Thank you. So the first question, I'm going to pose the question to you, Doc. What emerging opportunities do you see for Imo State SACA in terms of expanding access to PrEP, especially around new policies, partnerships, and state-level coordination?
Okay. Well, we are here to serve the people, and as stakeholders in the Imo SACA, we aim for the implementation of HIV program, especially as regards to PrEP. Which is still active in Imo State, except the upcoming ones that is injectable, which we are going to explore in due time.
So, Mr. Chinedu, I'm going to ask you, thank you, Doc.
Yeah.
How do you think the state, as a monitoring and evaluation officer, is aligning when it comes to partnerships with CSOs and youth programs in terms of access to PrEP?
Thank you very much for that question. Imo SACA is our activities is actually partnership driven. We collaborate a lot. In fact, without collaboration, I don't think we carry out our activities. So, and we have a lot of partners, including the implementing partner in the state, which is Caritas Foundation of Nigeria. The full name is Catholic Caritas Foundation of Nigeria. We also have CSOs in the state and the CBOs we are partnering with. We also have even the KP-led CBOs, those who are focusing on implementation of key population programs. They are reaching those communities. So, and they are the ones that need these long-acting PrEP mostly, because they are mostly at risk community. So we are partnering with them, and if we also have a special clinic for them, formerly known as OSS, One Stop Shop. Currently, it is now Community Service Center. So that center is used to provide PrEP and other treatment services for them. So we are partnering very well with our partners and also those who are implementing in Imo State. We're talking about HIV/AIDS implementation. Thank you.
Thank you. Okay, so despite progress, significant gaps remain in PrEP uptake and availability. When it comes to Imo State, what barriers do you think stand out the most, and what is limiting faster uptake?
Okay. Yeah, thank you for this question. In Imo State, HIV program is faces a lot of challenges. One is the how will I put it so that I will not hurt any authority. The lackadaisical attitude of the stakeholders. You know, sometimes we have I'm talking about generally HIV program. Sometimes we have stockouts, you know, of these test kits and consumables. And you can as well write and write and write and nothing happens, even if you have a budget, you know, in the state, but we approved, no implementation. So I believe the stakeholders need to reawaken themselves because we have been doing our own pain advocacy visits to them. So the issue of nonchalant attitude or I don't care stance posed by the authorities is not something to write home about. Even the test strips we are having and consumables we are having in the state now is being donated by the funders, the implementing partners. Some of them sometimes comes from NASCA. So you see that we have problem really in terms of implementing the HIV program in the state. So we need to maybe we beckon on you people also to help us in a little way you can to conscientize and if need be, pay advocacy visits to the stakeholders in the state, the governor, deputy governor, even the commissioner, because she might be the one to really push forward for them to really pay attention to HIV, program in the state.
All right, thank you so much.
I would also want to respond to that.
Okay, go.
Yeah,
Yes.
thank you, Doc, for that. I'll also, just like he was saying, there is knowledge gap, just like he mentioned, and be it at may, knowledge is power. So limited awareness about PrEP. People need to know about it before they benefit from it. So people really need to get that information. So I think that knowledge gap is a barrier. Of course, we cannot actually uh, talk everything here without talking about stigma and discrimination. It's also a barrier. The normal prep, it's not easy to swallow pills. So but this long acting prep, if it comes to play where somebody will be injected for 2 months or 3 months and comes back thereafter, after the next 2 months or 3 months, I think that will help. We also have the cost. It's of course it's expensive, and the state also need to be empowered to actually procure those long-acting
Injectables.
injectables uh, for people to benefit from it. So that affordability is also there as a barrier. So when you look at all these things, of course, when you cannot procure it, when it is not affordable, access to it becomes difficult. So people really the thing really need to be available before people can access it, which is also another barrier.
Thank you so much for
Yeah.
that. So one of the questions that always come up, people always ask is, now will there be a special training for injectables when it comes into play? Because people are saying it's one thing to take drugs and it's another thing to inject. So, and a lot of them keep citing examples of during the COVID time. You know how people were scared to take injections. Those who took it, they had a lot of side effects. What do you think when it comes to the support, the level of support that will be needed in terms of workforce training, service delivery, community engagement for people to, when these injectables really come into him, so able to say, okay, I think I could give it a try. And is there somebody that has taken it? What do you think, Doc, around it?
Okay. In this respect, I believe SACA as an agency has its own channel of communication. They have NACA, they have LACA, they have many people in the communities. They have all these mentor mothers. These stakeholders, I believe, needs training. They need to be trained on what to tell the public, the community leaders, because this policy is meant for everybody. So when these people, these stakeholders are being trained, because this is a new, uh, let me call it new drug that is coming in. I mean, new formulation. This one is injectable, so they need to be carried along so that they'll be able to inform the people appropriately and disabuse their minds about these so-called side effects. And having been trained, they will now cascade the training, to the hinterlands for acceptability, and it will also increase the, intake or adherence, you know. So this really is a new innovation that needed the stakeholders to be aware so that they were able to, inform the people appropriately.
And so, Mr. Chinedu, I mean, a program officer, part of your role, I'm sure you've involved in lots of training. What would you think would be in terms of readiness in training? Do you think people who have been involved in the daily oral pill, do they need to be retrained for the injectables? And if they need to be retrained, how do you think that will work in terms of partnerships, in terms of carrying CSOs along, in terms of engaging the youths, grassroots level? Because sometimes you find out that the gap between the urban and the rural is so wide that it may require a special kind of training to even go to the rural areas. What's your take about this?
All right, thank you very much. I appreciate that question because I think the acting DG, Dr. John Paul, has also touched on that. So capacity building is required because you cannot. There is difference between the injectable and the oral. So, in as much as somebody has been trained on the oral, the person also needs to be trained on the injectable. And there are different levels of capacity building. It could start from TOT, training of trainers, and those people will now cascade it down to the lacas and lacas to the facilities. And it's as simple as that. So we are not going to shift from what we usually do. We already have a structure on ground. So we also follow that training structure we have already established. So once you single out the key stakeholders, train them, and they will now cascade the training down to the local action committee on S, then those ones will now cascade it down to the facilities. And that is before you know it, the awareness will cover the whole communities in the state. So the capacity building is very, very key. And we cannot overemphasize that. Of course, CSOs need to be carried along. The community-led CBOs, the KP-led CBOs need to be carried along. The partners, implementing partners in the state need to be carried along. So once it happens, of course, everybody will be aware. So training is key. Capacity building is very, very important.
Thank you so much. So, we're concluding. We're going to be looking at. Sorry.